My name's Dr. Sawiris. I'm one of the nephrologists here in the Department of Renal Medicine in Whangarei Hospital. There are actually 4 of us, and we cover the whole of the Northland area, up from Cape Reinga all the way down to Tihana. In terms of telehealth, telehealth is actually a fairly broad concept that not only involves things like video connections, but also can involve remote monitoring. In the renal unit, we're not doing the remote monitoring side of things. We're very much into the video conferencing side of things, and it was initially started courtesy of our pediatric colleagues who put us onto this when we had a new satellite unit starting in Kaitaia. It was really important to try and maintain a virtual face-to-face connection with the staff, with the patients, to enable support of the staff, support of the patients, and support of our colleagues there. We actually use the telehealth every week on a Wednesday, where we have a multidisciplinary meeting. All 3 units link in, and we're able to discuss any patient movements, any complicated patients, any new starts to dialysis, etc. as a team, which just makes the whole issue of patient movement and logistics far easier. We've also used telehealth to undertake outpatient appointments when the plane from here, for example, hasn't been able to fly up to Kaitaia and the roads have been nasty. We've then actually undertaken clinics with the patients in Kaitaia, us based here, and a nurse with the patient in Kaitaia. Yes, we can't examine the patients as we would do if we were there, but equally it allows us to see if there's anything urgent, if we need to see the patient back more urgently at a sooner clinic when we are able to get there. And for us, we've managed to convince our tertiary colleagues in Auckland that a link with them is a good idea, which then enables us to link in for our own CME in terms of pathology, but also allows us face-to-face links with the team for regular transplant reviews and for radiology assessments for our fistulas. So really, telehealth for us just involves a linking of the various units together, so it's a more coherent structure. In terms of renal and diabetes, of our renal patients, 50 to 60%, the cause of their renal failure is diabetes, be it primarily or secondarily. And therefore, it really does have a big part to play. We have certainly tried to look to inform and educate our primary care colleagues and our other medical colleagues in terms of the importance of early, good diabetic care, blood pressure care, etc. But you know, the fruits of that will be decades in the coming. In terms of managing that better, that really isn't just a health-related issue, but goes back to not just primary care, but goes back to public health and very much health and diet education, and I would probably say from conception, let alone from birth, to improve diet and actually food safety within Northland. I'm still struck by the fact that we have GST on fresh fruit and vegetables in supermarkets, which gobsmacks me, and the fact that, you know, McDonald's and KFC can be cheaper than getting fresh fruit and veg. And we're then left wondering why we have this massive demand on diabetes care. I personally think it's fairly obvious.